Nathan, are you going to be in there all day? Honestly, I thought it was women who were supposed to take ages in the bathroom.
It takes time and effort to preserve these boyish good looks. What are you up to today?
Well, nothing, if I can help it.
I need to stop off at my flat before going to work. Any chance of a lift?
Oh, you should have said. I'd have got ready earlier. I haven't got time now.
I thought you weren't doing anything.
Well, I am. I'm going to the doctor's.
Why didn't you say?
Well, I forgot. I'm seeing Dr. Maguire about my legs again.
Good. And make sure you get him to tell you what it is this time.
I will.
You say that, but last time you let him fob you off with come back in 2 months. Maybe I should go with you.
Nathan?
All right. Just make sure you get the facts.
Yes, Dad.
Hello.
Hello.
Is no one looking after you?
No, I wasn't sure if there's a bell or anything.
We don't usually need one. What's your name?
Cindy Taylor.
I'll just get you up on screen. Patients are beginning to arrive.
Oh, I'm sorry. Our receptionist is still on holiday. What's your name?
Cindy Taylor.
I'll see if Dr. Maguire is ready.
If you'd just like to take a seat.
Your first patient's here.
Oh, good. Send him in.
Cindy Taylor. You saw her about 2 months ago.
I'll take your word for it.
Oh, she's the reason you kept going on about midriffs.
Oh, yeah, of course. And I still think you could wear one of those tops.
In your dreams. I had a baby in the last 12 months, in case you've forgotten. Anyway, I bet Ms. Taylor spends every day down in the gym. Or else she's had surgery.
Well, you know what they say. You're only as young as the woman you feel.
Groucho Marx.
Humphrey Bogart. Gee.
Dr. Maguire's ready for you now.
All right.
That's a lovely jacket.
Oh, thank you.
Went well yesterday, don't you think?
It's always nice to get everyone together like that.
Yes. Breaks down the barriers a bit.
I think we're pretty relaxed here anyway.
Bit of restraint's not a bad thing, though. Helps people to be clear about who's in charge. Shame Katrina wasn't there, though.
Yeah, I missed her too. She's always good at parties, very natural.
Good to have Mac back, though. Don't know about you, but my hours have been going through the roof.
Same here. I've hardly seen Phil over the last 2 weeks.
Have you noticed any change in the swelling or the discoloration?
Not really. I'm not sure it's going to be better.
Ah, well, I'd say it's got worse. What about the pain?
It's about the same.
Okay. Look, I'm going to refer you from an ultrasound of the veins. I think that deep vein thrombosis is a great possibility, and if that's so, then you're going to need anticoagulants.
But you said it might be leg cramps last time. They're a side effect of the HRT, aren't they?
Yeah, but you exercise regularly. I mean, you haven't had an operation. You haven't been immobilized. I mean, you're very active, aren't you?
Yeah, I never stop. My boyfriend's quite a bit younger than me, and well, he's fit.
Well, you haven't had a stroke. You're not overweight, and you're not pregnant. Hormone replacement therapy is the most likely explanation.
Okay.
And if the hospital confirms the diagnosis, it's just a question of finding the right drugs to break down the clots. It's not too much to worry about, honestly.
Right.
Good. But it means you can't go back on the HRT. If we'd known this was going to happen, we never would have put you on it in the first place.
Is Helen always that insecure?
What do you mean?
Well, her reaction when she saw us earlier, as though she thought we were hatching some kind of plot.
Oh, she's not insecure. Might be a bit used to being the tower of strength around here.
I see. And she finds me a threat.
Oh, I wouldn't say that. It's just how she comes across sometimes.
You know, I wonder if she's like that at home. I mean, it must be difficult with so many people dependent on you to let others take responsibility.
Phil's not exactly dependent. And he's got a job now.
Has he?
Yeah, community arts worker.
Oh.
Yeah, I suppose Helen's is the more important role.
He must be happier, though.
How do you mean?
Well, having an interest outside of the marriage. It's all very well staying at home with the kids, but it can unbalance a relationship. It's no wonder things go astray from time to time.
Oh, so, Helen's told you she's had problems in the past.
Well, you know how you pick up on things.
Well, if she'd known she'd nearly lose the kids, she'd have never let it go that far.
No.
Going through the menopause doesn't have to be a negative experience.
Oh, who's told you that?
There are things we can do for the physical symptoms.
Yeah, it's not just the hot flashes and the night sweats. I got really depressed.
Look, often it's not just the menopause that makes women feel the way they do. Emotional changes, middle age, they contribute too.
Yeah, well, aren't they the same thing? I'm 50 years old and I've lost my reproductive function. Isn't that enough to make anyone depressed? Oh, you probably don't understand. You're a bloke. Men keep their bits in full working order till they croak. A woman can't do that. Our bodies have a shelf life. And once we're past it, then that's it. We're supposed to grow old gracefully. Start wearing ponchos and keep lots of cats.
Hi, baby.
Oh. Why aren't you at work?
I thought I'd hang on to find out what the doctor said.
Oh, you're cleaning the flat?
Yeah? I thought I'd save your legs.
I'm not that old.
Sit down, then. Take the weight off them.
Oh, Nathan, stop fussing. I'm okay.
So what did he say, then?
Oh, just something about the pill I'm on making my blood clot too much and that it'd be safer to come off it.
Is that all?
Yeah. I've just got to stop taking it.
Right. Well, that's not the end of the world.
No. But there might have to be some changes, though.
Absolutely. It's not a problem at all. Trust me.
You're only 30. And you haven't had children, so why do you want a vasectomy?
Because the woman I'm going out with has already had kids, and I don't have any desire at all to be a father. So it feels like the logical thing to do.
But why don't you keep your options open? You may not want children now, but circumstances can change. Relationships don't last forever.
I'm as confident as I can be about this one. We haven't talked about marriage or anything, because she's already done it once. It doesn't mean anything. But we're serious. I can't see myself wanting to be with anyone else.
Okay. But why a vasectomy, though? What's wrong with other methods of contraception?
My partner's been advised to stop taking the pill because of her health, and I don't feel comfortable with any of the Barry methods.
To be honest, I have reservations about referring you for a vasectomy. But if you're absolutely certain that this is what you want...
I am.
One of my patients, he wants a vasectomy because his girlfriend can't take the pill. The thing is, he's 30, childless, and they've only been going out with each other for a year.
You don't think that's long enough?
No, it's a big decision to make.
Well, it sounds like he's made it. Why are you trying to put him off?
I'm not trying to put him off. I just don't want him to do something that he'll regret.
Don't you think he'll stay with his girlfriend?
I don't know. I just think he should keep his options open.
Well, maybe he doesn't want to. Maybe he's decided that she's the one. Or wouldn't you advise him to make that commitment yet?
Well, he can't be sure what's going to happen in the future.
Someone better might come along, you mean?
Well, if it was me, I wouldn't do it. And that's love. Makes you put the other first.
Guess what?
What?
I've just seen Dr. Kwame.
Why?
I'm going to have a vasectomy. Well, he said I've got to think about it, but there won't be any problem.
Nathan, you don't need a vasectomy.
Yeah, I do. Now that you can't take the pill, it makes sense.
But what about having children?
Why does everyone think I'm bound to have this urge to procreate?
Well, not now, maybe, but what about in the future? How do you know how you feel then?
What are you saying? That I'm going to look for someone else just because I want to have children?
Well, it's possible. You might decide you want to start a family. Be with a woman who hasn't done it all before.
And that's in the back of your mind, is it? You're assuming that this is some temporary stopgap until I settle down with someone my own age?
No, but I have to be realistic. I don't want you to miss out.
Are you kidding? You think that all that stuff we do together is less important than having babies? How'd you work that one out?
Well, it can't go on forever.
Why not? I love being with you, Cindy. You stress about being older than me, but it's only 10 years, for goodness sake. 40's not old, not really. Compared to women my age at work, you're like a breath of fresh air. They sit there with their diet milkshakes and whinge about getting their figures back and doing up their houses. But you just get on with living.
I'll go make some coffee, eh?
They're the ones that are middle-aged, not you.
I am not afraid of commitment.
Sorry?
What we were talking about earlier. You were trying to put words in my mouth.
I don't think anyone could do that.
Look, why are you being like this? It's not like you at all.
What do you want me to be like?
More honest.
Honest?
Yes. You saw me with someone else. And it's bound to hurt a bit. It always does, but...
If you say so. You should be careful, though, in case anyone else finds out about you and Carly. It might be anything to do with me, obviously. I'm just saying. And talking of honesty, there's one thing I don't get about all of this. You've always been so critical of your father, and, well, now look at yourself. How come you're doing exactly the same thing?
Hi, baby.
Oh, how come you're back?
I've told them I'm working from home today.
But you're not.
I did think about work while I was doing the hoovering, but then I got distracted by what we're going to have for dinner.
Oh, you make a great dad, you know.
There's a lot more to it than just being able to cook and clean. I'm too selfish.
You're so not.
I am. It's just you don't see it, because being with you means I get everything I want.
Like what?
Honestly, why are women so insecure? Love, happiness, friendship, everything. Don't I do the same for you?
Yeah, totally.
There you are, then. It's really not that complicated. Cindy?
Oh!
Baby, sit down. Cindy? Cindy?
Hello, Riverside. Oh, hi, Beth. I'll put you through. Faith. Oh, I'm sorry. Can it wait? I'm really snowed under.
Dr. Maguire?
Yeah, it's me.
Something's happened to Cindy.
You better come through.
You only saw her this morning and now she can't breathe.
It's all right.
I told her to make sure you sorted it out.
all
You
right.
can't have examined her properly.
It's all right.
Why don't you stay here? Okay? Dr. Maguire's looking after Cindy now. Come on.
I think you've developed a pulmonary embolism. A clot in your leg has moved and ended up in your lung, blocking one of the branches to the pulmonary artery.
Is it serious?
Well, it can be. Look, I'll get you to hospital. They may do a scan, or they may just observe until the embolism dissolves. Is that okay?
Yeah.
Good. Kate, can you get hold of an ambulance ASAP? Yeah, suspected pulmonary embolism. Good, yeah, thanks.
Oh, I'm really scared.
Cindy, look, you can still breathe, which means the embolism is only depriving part of your lung of blood. Just try to stay calm.
Okay.
Shall I call your boyfriend?
Oh, no, Dr. Maguire. You mustn't tell him anything about the HRT.
What?
Well, he doesn't know I take it. He doesn't know about my menopause.
But what about the symptoms? You said it was so hard staying off HRT.
I lied. I'm sorry. I never stopped the treatment. I tried. But I was scared of losing him.
Oh, great. You would risk your health to stay on HRT.
I told you I'm not ready for the menopause.
He must know it's going to happen sooner or later.
No. Women my age don't get the menopause. He thinks I'm only 40. Oh, What's 10 years between friends, eh?
I've just called the ambulance. She's not in any immediate danger, but Dr. Maguire would like her to be seen at the hospital.
Does he know what's wrong with her?
I think it's best if you let him explain. The ambulance will be here in a few minutes.
Right.
I'm just going to meet Beth at the leather bar.
Oh, OK.
I'll be about 20 minutes.
Oh, there's no hurry.
Yes, there is. I've got a pile of paperwork that's not going to get done by itself.
What is it with those two?
Why did you lie about your age?
Well, I didn't lie. I just never told him the truth. I know I don't look 50, so I spoil the illusion.
Because that's what it is, Cindy. An illusion.
It's not, you see. That's the funny thing. The HRT, it really is amazing. I feel younger and fitter and more attractive. Nathan and me are really great together. It doesn't feel as though there's any age gap.
How can you be yourself if he thinks you're 10 years younger?
Oh, I know, but if I don't feel 50, why should I be 50? The men my age are all losing their hair and talk about nothing but golf and pensions. I feel true to myself, and that's what matters.
Nathan?
They're taking Cindy to hospital.
Is that your partner?
Yes. She's got a problem with her breathing. Do you think she'll be okay?
Well, I'm sure they'll be able to tell you more once she gets to hospital.
Is that it? I've never been in an ambulance.
Oh, I'm fine, really. I don't need a wheelchair.
Cindy, do as you're told. See, she just needs a firm hand.
You coming with me?
Of course. I'm not going to miss out on my only chance to legally break the speed limit, am I?
Oh, what about my things? I need my things. Oh, Nathan.
I'm right behind you, baby.
Nathan, look, try not to worry. They know what they're doing. I'm sure she'll be okay.
Yeah.
Do you know what's wrong?
Pulmonary embolism, I think.
So the health problem that Nathan was talking about were related to abnormal blood clotting.
Uh-huh.
Is that why you told her to stop taking the pill?
HRT pills, yeah.
HRT? Nathan thinks she's taking oral contraceptives.
Well, she's not. She's 2 years into the menopause. I don't think that contraception is an issue.
But she hasn't told Nathan that.
Oh, really? Well, she has admitted to being less than honest about her age.
But what about Nathan? He's planning a vasectomy.
He's planning on what?
What am I going to tell him?
Well, I don't think it's your job to tell him anything.
Oh, come on, Mac. He's one of my patients. I'm not going to refer him if I know it's not necessary.
I know, but this is Cindy's problem. I think she's the one who's going to sort it out.
Mac?
I'm off to the hospital. Well, you leave it with me, Ben. I think she's going to need some persuading. He deserves to be told the truth.
Oh, is that what you've come to tell me?
He wants a vasectomy. Did you know that?
Yes, but I won't let him go through with it.
You were planning to tell him.
I don't know. Aren't I supposed to be resting?
I'm not here to bully you, Cindy. It's your decision. But you are coming off the HRT, right?
Well, yes, of course. I thought I was dying.
Will you still feel 40 without the estrogen? That is the question.
Well, it's an attitude of mind, isn't it?
You said the HRT made you feel better than ever before.
Yes, but it's being with Nathan as well.
Let's hope so, eh?
What do you mean?
You do understand that this new lease of life is artificially induced. Feeling like you did when you were younger, it's not real. When you stop taking the estrogen, your libido and energy levels are likely to decrease.
Oh, thanks a lot. And I've been lying here telling myself it's not going to be that bad.
Well, the menopause might not be. You were talking about being true to yourself.
It's not just the estrogen.
Of course it isn't, but when you stop taking it, are you going to be the person Nathan thinks you are? Wouldn't it be more honest to tell him the truth?
How can I? I've lied to him for a year.
Well, I'll tell him what you told me. If he really cares, he'll understand.
So what is it? Is Sean been in contact again?
No, not exactly.
Well, he's had £20,000. You can't expect anything else.
No, I've not heard from him.
Then why am I here?
Because I think that we should contact him.
What? I want that money back. It's your savings, and I had no right to even take it. Is this what you got me here to say? I thought he was threatening you again. No, look, I've been thinking. Look, I am prepared to live with the consequences of going to the police rather than the guilt of stealing your money. Don't be so stupid. Look, are you not listening to what I'm saying? I'm prepared to report him for blackmail. That money could be back in your account before you even miss it.
Nathan.
Yeah, baby?
I need to tell you something.
Go on, then.
It's serious.
Deathbed confession.
Oh,
Excellent.
no, don't choke about it, please.
I'm sorry. You look so tragic lying there. I can't stop trying to cheer you up.
I've lied to you. Not deliberately. It just happened when we started going out together, and the longer we were together, the harder it got to tell you.
Is this about some axe-wielding ex-husband?
No, Nathan.
But you're scaring me, baby.
The pills I was on, they're not contraceptives. They're HRT, hormone replacement therapy. It's what you take when you...
Have the menopause, I know.
And mine started 2 years ago, when I was 48. I'm sorry.
What?
Sean won't have spent the money. How could he? You don't get rid of 20 grand in 2 days. Beth, grow up. I don't care about the money. And if it stops us being in this constant state of crisis, then believe me, it's a small price to pay. Jude, you've got to let me make amends or it's not fair. Goodbye, Beth. Look, Jude, wait up.
You're 50. Why didn't you tell me?
Oh, I don't know. I've always felt younger than I am, and it never felt as though I was doing anything wrong to just let people assume what they wanted.
Not people. I was going to have a vasectomy for you.
I'd never have let you go through with it.
Why didn't you just tell me the truth? It wouldn't have made any difference. Why do you make up this whole story about being on the pill? Why didn't you just say it was HRT?
I didn't think you'd want to be with me if I was going through the menopause.
Oh, that's so vain.
No, it's not. Before the treatment, I was so depressed and irritable, flushing and sweating and goodness knows what. I wasn't me at all. And then the HRT sorted it all out. I could get away with being 10 years younger.
So you're going to keep me deceived indefinitely?
I didn't know the relationship would last this long.
Do you know how that makes me feel? Like some gullible little toy boy that you've picked up to give your ego a boost. Well, I hope you've enjoyed the joke.
I didn't know how to tell you. Dr. Maguire said I should stop taking the treatment 2 months ago, but I couldn't. I couldn't face losing you.
Well, it looks like you just have. Let me get this right. You carried on with the HRT treatment even though you knew it might have been causing your problems?
Yes.
But that's so stupid. The menopause can't be that bad.
I couldn't put you through it. It wasn't fair.
Can't you credit me with a bit more integrity? I thought we had a proper relationship, you know, where we connected here.
Well, old habits die hard.
What does that mean?
Well, you know, trying to look as good as you possibly can for as long as you can is what men expect of us.
Oh, come on. Don't you dare try to make all this my fault. I better go now.
Yeah, well,
don't want to stop seeing you.
It's best this way. I need to sort myself out. Buy some support tights and start acting my age.
I might as well stick around at least until you got over all this.
No.
But you'll get depressed. You said it's a symptom.
It's not your problem.
I'm gutted about all this. I feel hurt and stupid and angry. When you take all that away, I feel the same about you now as I did this morning. So what am I supposed to do?
Oh, I don't know. I just wish I'd met you 20 years ago.
What, when I was 10? No, that would have been a bit suspect.
Oh, don't make me laugh.
I've had enough shots for one day. Can't we just take this a step at a time?
Please, Beth, will you stop this now? Just let me get on with my life. That's what I'm trying to do. No, you're not. You're still not letting go. We made a mistake. We caved in too quickly. The guy's a psycho. How long's it going to be before he decides he wants the rest of the money that we owe him? Beth, I have spent the last 8 years worrying about what we did to Sean and Bolivia. I have no intention of wasting the next 8 years looking over my shoulder, waiting for him to demand the next 20 grand. Nor do I. That's exactly what I'm saying. If he has got any sense at all, he will consider the debt has been paid. That's it now. No more guilt, no more threats, and no more thinking of the past. I want you to try and forget that we've ever met Sean Wright. Look, I told you, that is what I'm doing. Good. So we can just get back to normal, yes? Yes. Just like he never existed. Right.